I'm Joe Keating. I'm an associate professor here in the department. I've been at Tulane about 8 years or so. 2005, I arrived at Tulane University. I currently teach 3 courses, 2 in the graduate program and 1 in the undergraduate program. I teach in the fall semester an impact evaluation introduction course, which covers mostly the materials, methods, systems that we use to conduct either program level or intervention level activities and subsequent evaluation studies, mostly in sub-Saharan Africa. I say mostly only because we also work in other parts of the world, but the bulk of our work is in sub-Saharan Africa. So at the moment we run sentinel surveillance sites for malaria epidemic detection in Ethiopia, which is incorporated into the evaluation course as well. We talk about recent impact evaluations in Eritrea, looking at indoor residual spray in terms of the added benefit over and above what they're already doing, and in Zambia, a CDC-funded impact evaluation, all of which is incorporated into the evaluation course. It's meant as an introduction, not to serve as a know-all, but certainly there's other courses that would serve to complement that well. I also teach a population-based malaria research and control course in collaboration with other colleagues here in the department. This sort of is geared towards the student that plans to work with rollback malaria, WHO, a demographic and health survey team, basically doing malaria at the programmatic level. It's an overview course, so it's really designed to cover the biology, the mosquito ecology, the epidemiology, and then sort of trends in where we're at in terms of reductions. The third course is an undergraduate course, which is called From Biology to Policy. It's a strategies in public health course. We basically take a handful of diseases every semester and walk through the molecular all the way through the ecological, epidemiological, and end with policy implications for the research generated around those studies. The last capacity I serve in here in the department is one as MPH director, which basically that means I'm in charge of listening and speaking to concentration leads and brainstorming with these groups on how best to improve the program based on student feedback, faculty feedback, and the needs and expectations in the community. While I was doing my master's program through the Center for International Affairs at Ohio University, I was introduced to tropical disease biology and subsequently to epidemiology, and was invited to work on a Chagas disease project with colleagues up there down in Ecuador. That was my first introduction and first clue that public health might be an area that would be of interest to me. But again, is sort of putting different things together. I didn't really know what public health was. Quickly learned that there's inherent interdisciplinarity in what public health can do and the expertise they required to do public health. So I felt as my graduate studies continued that was a logical place for me to end. But again, I wasn't set out to do public health. When I came to Tulane University, which is where I did my doctoral studies, I was focused more on the biocomplexity of disease. Obviously had to take epidemiology courses, biostatistics, things of this nature that form the core of public health, but I was more interested in vector ecology, mosquito ecology. And so when I finished, I immediately took a position at University of Miami in their School of Medicine working on vector ecology studies in Africa. That's where I did my postdoctoral fellowship and then returned to Tulane in '05, where I sort of put those skill sets to action and tried to do something within the public health field. So if I were giving advice to students just entering an MPH program or perhaps just new to public health in general, I would really offer one concrete piece of advice, and that would be tackle the skill set issues immediately. They may not be the most interesting courses at the onset, and you may feel like you lack the topical knowledge to make that adjustment, but you can do that later. You know, the skill sets are where you need to be focused. Quantitative skill sets are extremely important. The qualitative methods also, big job market out there for those. Other types of skill sets that we use, biostatistics, study design within the construct of epidemiology, information technology, also important. If you can manage data, analyze data, you're in a competitive advantage. So understanding systems like geographic information systems or management information systems, these become very important. They're not just buzzwords that you'd put on a resume. these are actual skill sets that can be used within public health and are used for a variety of very important reasons. So skill sets is where the focus should be. Not to undermine the importance of getting a well-rounded education and understanding some topical aspects of public health like malaria or onchocerciasis or something like this. But unless you plan to get into the research side of public health, much of that information could be obtained from reading peer-reviewed literature or getting a tropical disease biology book, and likely get the same amount of information. If you're planning to go into research, then yes, those courses would also be needed. But for the average MPH student trying to get a job internationally, domestically, skill sets are what they should be focused on.